Welcome to the Wellness Radio podcast with Drs. Warren, where we have taken our live radio show episodes and transformed them into easy listening podcast episodes. Make sure to check out our website, drswarren.com, where you can find out more information about us, including how to work with us both in our clinic locally in Chattanooga, Tennessee, or virtually worldwide. You can also shop our favorite supplements that actually work, and most importantly, join our newsletter where we give you tons of free information on how to take your health to the next level.
All right, guys, welcome to the Wellness Radio. I am your health expert, Dr. Nathan Warren, and I've got a great show lined up for you guys today. It is going to be all about kidneys. So we're going to talk about how to maintain healthy kidneys. What does it look like to have kidney disease? What are the different types? We're even going to dive into things like kidney stones, blood pressure, some of those things. So if this is your first time tuning into the Wellness Radio, welcome. We're excited to have you here. A little bit about myself and my beautiful wife, Dr. Rebecca Warren. We are local doctors here in Chattanooga. We are structural corrective chiropractors, and we also do functional wellness. So we dive into a holistic view on how the body functions. We recognize that it is intelligently designed by God to heal and self-regulate and adapt to its internal and external environment. And so we also know that based on that foundation, that the body is designed to heal as long as there's nothing interfering with those processes. And so our goal in our clinic, whether it's dealing with structural corrective chiropractic or from a functional wellness perspective, is to say, what is the root cause? What has created these issues? What is not dialed into the lifestyle? What is the decades or even years of journey that brought you to this disease state? And then work on reverse engineering the process and watch the body do what it does best, and that is adapt and heal. And so what we also know is that the body doesn't harm itself, right? It doesn't make dumb mistakes. The body only adapts. So, if you're talking about a body that has to choose between a rock and a hard place, well, guess what? The body's going to do everything it can to survive. A quick example of that is, if you're obese, right? If you've got too much weight on the body, well, guess what the heart has to do? It has to work harder. It has to pump harder. What is that called? It's called high blood pressure. And so we look at that, and from a medical perspective, they say, oh, that the body's just making a mistake. Dumb machine making a mistake. However, when we really analyze it, that's the body adapting. Same way with cancer, same way with heart disease. The body adapts to keep you alive as much as it can until it hits a limitation of matter. So in our clinic, we work on root cause, right? Figuring out what is the root cause to your health issue. And when we do that, we get to see amazing results. So we get to see, patients over time, safely with the help of their medical physicians coming off several medications. We get to see people, dropping 30, 40, 50, even 60 pounds of weight and building up their muscle mass. We get to see people, thrive that used to have thyroid disease and adrenal dysfunction. We get to see, gut dysfunction and issues with digestive system heal and function appropriately. We get to see all of those things in our office, and it's not because Dr. Rebecca and I are just these magical practitioners. It's because we recognize how intelligently designed you are. We recognize how no matter how much Dr. Rebecca and myself know about the body, we'll never know everything, and that the body's always more intelligent than we are. And so our goal is to remove whatever's interfering with your healing processes and let the body do what it does best. And so in today's show, we're going to be talking all about kidney health. And so this is something that I wanted to go over with you guys because I've had 3 or 4 requests for it over the last, couple weeks in my clinic to talk about kidneys. And really, I don't know if we've ever fully taken a dive into kidney health and looking at it in depth on the Wellness Radio. So this is going to be an exciting one that we're really going to break down and look at, what does the science say, right? What does the clinical research say? But also, what does things like logic and, ancestral wisdom say about it as well? What does our clinical approach look like? And what is our clinical experience with the kidneys and with kidney issues and kidney health? So we're going to kind of take it from several different views here so that we can put it together and really get an idea of what you need to do to keep the kidneys healthy. Now, as we go throughout the show, if you want to learn more about myself or about Dr. Rebecca or about our clinic, all you have to do is go over to doctorswarren.com. That's DRSWARREN.com, doctorswarren.com, and you can find out more information about us. And so before we jump in, I did want to give a couple announcements so that you guys know what's going on in our clinic over the next month, because these are really exciting things that we've worked hard to make sure that we're bringing to you guys. And one of those is going to be on December 11th, Monday night. Right. So just like our heart health talk that we had a couple months ago, we're going to be doing it over at Oaks Coffee Shop. So right off of the Bonnie Oaks exit. And it's going to be all about, so it's our fifth annual diabetes summit. Now, this one's going to be different, though, than the last few, because I'm really going to be taking a major approach on looking at nutrition, looking at nutrient density, looking at, what are the appropriate ways to feed the body, to energize the body, to give it the information and the fuel that it needs, how to know when to vary the diet, what types of diets are good, and for what time periods of life are they good for. So we'll be talking about things like, ketogenic diet. We'll be talking about carnivore, vegan, plant-based. We'll be talking about all of these, high protein, low protein, diving into exactly what we need to do from a nutritional standpoint in order to maintain health and maintain, proper cellular metabolism, proper blood glucose and insulin balance. And in today's world, it's even more important because there is so much confusion on nutrition overall. Because, you go on Google, you go on Instagram, TikTok, you go on any of those social media sites, and you get 1,000 different answers, right? There's a million diets out there. How do you know what to consume? How do you know how to eat? How do you know if it's right for you as an individual and for your individual biology? And we're going to dive into all of that at this diabetes summit. And so you can basically go to doctorswarren.com. That's a great way to sign up for this. It is a free event, but we will sell out. Just like with the heart disease talk, those of you that went, we had to cut it off because we only have so much space. And we already have, this early on, we already have 35 people registered for it. We're doing the cutoff at 80. So again, it will fill up, and it'll probably fill up in the next week or two. So if you want a seat, if you want to bring your friends, your loved ones, go ahead and get registered for that today by going over to doctorswarren.com, DRSWARREN.com. Come spend some time learning. It's going to be a lot of exciting information, a lot of new information that you haven't heard before. And we're really going to dive into some fun stuff. So doctorswarren.com to get signed up for that. And then the last announcement is this upcoming month, December, in our office, we are doing appointments for donations. So it's going to be a lot of fun. So if you have been thinking about coming in and seeing us, getting an exam, finding out what our office is about, and really wanting to take your health to the next level, there's no better time than the end of the year, right? There's no better time because you have the new year coming up, and we know the momentum you create at the end of the year dictates the momentum that goes into the new year. And I think a lot of times people think, I'm just going to wait till the new year. That is a big, big mistake when it comes to your health, We know that waiting on some of those New Year goals, most of them fell within, February and March. So we really want to get the momentum started now. So if you've been thinking about that, you want to, come in and see us, you want to become a practice member, you want to, get an exam, x-rays, things like that. Again, guys, it's $120 value. But you get to make a donation, right? Whatever you feel is appropriate. That money is going to be donated to the charity that we're working with. And so in order to lock one of those things up, one of those appointments up, go to doctorswarren.com, DRSWARREN.com, and you can get signed up for an appointment there. You can also you can go to doctorswarren.com to find out more information about us as well. So let's dive into today's show here. And again, it's all about the kidneys. So I'm excited to bring this information to you because I don't know if you guys realize how big of an issue kidney problems really are. And so when we're looking across the board at kidney issues, basically what it looks like is this. More than 350,000 Americans undergo dialysis treatment annually. More than 100,000 people in the U.S. are waiting for a kidney transplant. We know that 1 in 10 Americans have chronic kidney disease. 1 in 10. That's a big number. Heart disease is the number one cause of death for people with chronic kidney disease. We know that diabetes and high blood pressure are 2 leading causes of chronic kidney disease. 1 in 3 American adults are at risk for kidney disease. So we know that this is a major issue, right? This isn't something that is just random. It's not something that is minute. This is directly impacting the overall health of human beings, especially in America. So we really got to dive into this to fully understand. So when we're looking at the kidneys, they're 2 bean-shaped organs, and basically they perform several different functions, but they act as a filter. They get rid of waste products and excess fluid. The kidneys balance your bodies, right? Electrolytes and acidity. They help to control blood pressure, and they even help to produce hormones. So very, very important to have proper kidney function in order to have a healthy body. We know that even at the end stage of life, one of the main things they check is kidney function, right? If the kidney if the kidneys are failing, that is a sign of end of life. So when we look at kidney problems, they include things like kidney stones. They include things like acute kidney injury, chronic kidney disease, and then things like end-stage renal failure. So we're going to dive into all of those and kind of go over what are some solutions, what are some things that you can do now to protect the kidneys, what can we do to start, even reversing some kidney disease and seeing improvements there as well. And so again, before we go to break, make sure you go over to doctorswarren.com, DRSWARREN.com, and there you can schedule an appointment. Again, for the donation for this month, it's the holiday season. No better time to start taking care of your health. doctorswarren.com to get signed up for that, as well as our Diabetes Summit coming up on December 11th at Oaks Coffee Shop. It's a free event, but it will sell out, so get your seats now. All over there at doctorswarren.com. This is the Wellness Radio. I'll see you right back after the break. Today's show on the Wellness Radio, we are going over kidney health, right? What does proper kidney function look like? What are some of the tests that can test kidney function? We're going to dive into, some of the biggest topics on kidney disease, right? Acute kidney disease, chronic kidney disease, end-stage renal failure, kidney stones, some of the biggest things that are impacting Americans today. So we know that when we look at kidney issues, 1 in 10, so 26 million Americans have chronic kidney disease. We know that about 100,000 people in the U.S. are waiting on kidney transplants, and more than 350,000 Americans undergo dialysis treatment annually. So when we're looking at kidney disease, we have to understand that it's a multifaceted thing. So when we look at the kidneys, we talked about in the first segment how Kidneys work on filtration. They work on, removing excess fluid. They work on the acidity of the body's electrolyte balance. They help to control blood pressure, and they work to produce various hormones. So when we look at the two main causes of chronic kidney disease, those are going to be high blood pressure as well as diabetes. And how many people in the United States and even worldwide are dealing with high blood pressure and diabetes? I would say in our clinic, about 6 out of 10 patients that come in to see us have one or both of those issues, right? They're either on 1, 2, or 3 high blood pressure medications, especially when you look at men over the age of 40. And then also looking at diabetes, we see a lot of type 2 diabetes. We see a lot of pre-diabetes, right? Like just not diagnosed yet, having major issues with blood sugar and insulin imbalance. And so while we're on the topic there, looking at diabetes and its effect on the kidneys, remember that we have our upcoming 5th annual diabetes summit on December 11th that you guys can get signed up for, a free event at Oaks Coffee Shop. It will fill up, so you want to get your seats today. It's a free event, but once we're out of room, we're out of room. We only have so much space. Our last heart health talk that we did there officially booked up, so we did not have any more room, and we had to shut it down. So if you want those, go ahead and get it. There's no better time to start taking care of your health than right now before the end of the year. Build up, right, that momentum going into the new year. Now, when we look at the kidneys, kind of diving into this here, I mentioned before that this is a big topic with my patients. So, we have to understand that when we look at what the kidneys do, one of the primary roles of the renal and urinary system is to aid in detoxification by filtering and removing waste products. Things like drugs, right? Things like toxins. We know we're exposed to 90,000 plus toxins on a yearly basis, according to our own EPA. We also know that when you look at drugs, it's not just recreational drugs. We know a lot of medications directly affect kidney function. And when you look at the amount, you're looking at about 65 to 80%, depending on the study that you look at, that directly have a negative impact on the kidneys. And the longer you're on a medication, the worse that impact is, right? So as an example, you're put on high blood pressure medication. When you look at like studies looking at about 2-week use all the way up to 2 or 3 year use, yes, it can be kidney protective. But once you start looking at long-term studies on high blood pressure medication, we know that long-term studies show it can be kidney damaging. We know things like NSAIDs, right? Things like over-the-counter pain medications, acetaminophen, things like aspirin. We know those can have a negative impact on your kidneys. So we want to make sure that we're addressing proper kidney function and understanding that, hey, yes, medications can save lives, but they can also take lives, right? They can, and if we're not getting down to the root cause and we're relying on a Band-Aid solution, especially with medications and drugs, guys, you're in trouble, right? And your kidneys are in big trouble. So again, looking at what the kidney does, just to kind of give an overall view of it, we know that it regulates blood pressure, right? So make sure that the pressure isn't too high or too low. Both of those can be damaging. We know that when it comes to the heart, how the kidneys affect the heart, maintains a balance of electrolytes like potassium and sodium and calcium, which is critical for heart rhythm. We know that it affects our water inside of our cells and inside of our body, ensures that there's not too much or too little water in the body. When it comes to the blood, releases, something called erythropoietin, which tells things like bone marrow to make red blood cells, which is massively important. An acid-base balance. We know that it makes sure that the body isn't too acidic or that it's too alkaline, which is very, very important for preventing, things that can, directly lead to death. It affects our bones, so activates vitamin D, which helps the body absorb calcium. And then obviously it helps to gets rid of waste, so things like urea, uric acid, toxins, and other waste via the urine. So these are all important things that the kidneys do that we need to make sure is functioning appropriately. And we're going to go over how to look at that as well too. So one of the first ones I want to dive into is kidney stones, mainly because this is something that I hear a lot, and this is something that's recurrent. It seems like when people have a kidney stone, they're then more likely to have more. Now, is that because of the damage to the tissue and it kind of starts that snowball effect? Possibly and probably partially, but also too, I think the other thing is understanding that if there's one kidney stone there's usually many kidney stones, and these kidney stones form over years. And a lot of you guys, even though you may be living a healthier lifestyle now, had an issue with your lifestyle, for decades or for years. So we know that's how they build up inside of the body. So when we're looking at kidney stones, man, this is one that I find, possibly the biggest, pain experience that people will have. You almost know that if somebody is experiencing pain, like on their sides, like kind of like low back pain into the flank of the body, kind of rounding around, or if they see it travel from the low back to the front part of the side of the abdomen, you can almost guarantee that it's a kidney stone, especially if they use phrases like, "This is the worst pain of my life," or "I needed to go to the emergency room because I was in so much pain." It's like it's almost a safe bet that you can assume kidney stones. And when you look at kidney stones, these are solid pebble-like masses that can form in one or both of your kidneys. And so, they occur when there's high level of like certain minerals, such as calcium and oxalates, and uric acid, in the urine. And these symptoms can include things like blood in the urine, sharp, severe pain in your back, your side, your lower abdomen, or even into your groin. Again, a big sign is that it's traveling over time. That kind of shows that. And when we look at the kidney stones, sometimes they're small enough where they pass and you have no problems, but the larger ones can create blockages, severe pain. In some cases, they have to be surgically removed because they're so big. So we know that, when you look at kidney stones, they can be a major issue. And the other problem that I have with kidney stones is, again, most of the time they end up going to the emergency room. And so in the emergency room, you can bet what that looks like. Most of the time, that just looks like getting put on high doses of pain medication in order to just basically limit symptoms until your body can pass it. And we know that these high doses of pain medications, they can lead to things like addiction, but they can also damage the body, right? Every drug has a side effect. Every drug has, we know that even though it can benefit you, it's also going to have drawbacks as well, right? That comes with a price. And so we want to make sure that we're preventing that as well. So kidney stones are a big issue. Another one is looking at acute kidney injury. This can come from things like heart attacks can create acute kidney injury, illegal drug use or drug abuse, or, medication abuse, renal infections, and things like low blood flow to the kidneys and urinary tract issues. So UTIs, they can lead to acute kidney injury. And again, that's a big deal. Things like chronic kidney disease, when we're looking at it, this affects about 10 to 16% of adults around the world. And when chronic kidney disease reaches an advanced stage, creates dangerous levels of fluid, electrolytes, and then waste buildup in the body. And again, that ends up killing you. So, chronic kidney disease is a really, really big deal in this country that we have to pay attention to. And then the other things that when we look at chronic kidney disease, one of the reasons that you're going to notice, especially in the next couple segments that we're going to talk about, one of the biggest causes of chronic kidney disease is metabolic disease like diabetes. And that's mainly because it creates this accumulation of what are called AGEs, or advanced glycation end products. And these act like shrapnel and they damage the tissue in the kidneys. And so one of the biggest causes of chronic kidney disease is diabetes. All right. So before we go on break, remember to go over to doctorswarren.com. If you want to take advantage of scheduling one of those appointments, coming in and seeing us in our clinic, guys, it's for a donation. So we are donating all of our exams and x-rays, the cost of that, what you guys pay, that is a donation during the month of December. So if you want to take advantage of that, go to doctorswarren.com and you can sign up for that there, as well as our diabetes summit coming up on December 11th. Get you and your loved ones signed up now. It will fill up, so you want to get your seats now. All over at doctorswarren.com. This is Wellness Radio. We'll see you right after the break. We are talking all about the kidneys today. I've gotten several requests to go through this in this show. So it's a great topic because it affects so many people. I had mentioned early in the show, 10 to 16% of adults worldwide are dealing with chronic kidney disease. We know it affects, kidney issues affect about 1 in 10 Americans. So we're looking at about 26 million Americans are affected, by kidney disease. So this is a big one. We want to make sure we're taking care of the kidneys because they're involved in so much like electrolyte balance, blood fluid volume. When we look at things like certain hormones that are produced, making sure that you're not too alkaline or acidic in the body. These are all things that the kidneys do and so much more. So before the break, we were talking about chronic kidney disease. And again, one of the major contributing factors to chronic kidney disease are high blood pressure and diabetes. And again, I see this a lot in our clinic. And when we look at it, again, this is something I'm going to be going over quite a bit at our 5th annual Blood Sugar Summit that's coming up on the 11th at Oaks Coffee Shop. So make sure that you get signed up for that over at doctorswarren.com. We're going to be going over all the information about, especially with type 2 diabetes, how to reverse that, naturally and change your lifestyle, understand nutrition, understand exactly how to eat, how to switch up your diet when it needs to be varied, how to understand when to fast, when not to fast, how to fast. We're going to dive into all of that at this. So make sure that you get your seat. But when we look at the effects of diabetes on the kidneys, it's because of these advanced glycation end products. And we're going to talk about that here in just a minute. So to give you an idea, chronic kidney disease goes in stages. And I wanted to mention this because I think this is so important. When you look at stage 1 and stage 2 of chronic kidney disease, it's interesting because stage 1 and stage 2 show no symptoms, right? So I think this is a big point because especially with cancer, heart disease, kidney disease, diabetes, all of these different things, when they're building up in your body, remember early on, there's no symptoms, which is one of the reasons Dr. Rebecca and myself in our clinic, we don't just go based on symptoms, right? Like those symptoms are warning signs and we need to look at that check engine light when they show up. But we have to understand, we have to figure out the root cause. And also, when we look at health, health is not just the absence of pain or disease, right? It's not just about your symptoms. It's about function. It's about optimal function. And so we have to look at it well before symptoms show up. But stage 1 and stage 2, you have to understand, have no symptoms. And so when we look at stage 1, no symptoms, other health issues that are a precursor, we mentioned diabetes, we mentioned high blood pressure, but also obesity. So being overweight is a contributing factor to chronic kidney disease. When we look at stage 2, this is where we're hitting about 60 to 89% function of the kidneys. One of the things that starts to show up is protein leaking into the urine. So if you're getting a urine analysis at your doctor and we're starting to see some of the protein in the urine, this can be a sign that you're already, starting this kind of chronic kidney disease state. Once you hit about stage 3, where we're about 30 to 59% function of the kidneys, now we're talking about like swelling, So if you get any swelling in your ankles and your feet, this could be a sign of chronic kidney disease. Fatigue, back pain, things like foamy or darker urine, having albumin show up in your urine, right, which is a protein showing up in your urine. Your doctor starts talking about food restrictions like sodium and phosphorus. Once you hit about stage 4, now we're talking about, some more severe type of symptoms that show up, like sleep issues, starting to talk about kidney dialysis. When we look at things like, difficulty concentrating, so now it's affecting your brain. Things like nausea and vomiting, tingling and numbness in the toes and the fingers. So seeing neuropathy actually start to show up. These are going to be more signs of stage 4. And then obviously stage 5, now we're talking about weakness. We're talking about easy bruising and bleeding, anemia that shows up on your blood work, thirst, and cramps always showing up, like especially cramping at night. This is where we're in big trouble, and now we're talking about transplant at this point. So we have to understand chronic kidney disease is a major contributing cause to kidney failure and death overall in the United States. So we have to understand this is a big deal. Now, diving into and understanding, issues with kidney disease. Obviously, I want to throw out some of the big ones right off the bat. Because your kidneys are primary defenders against harmful toxins and those toxins entering the bloodstream, we obviously have to note that, smoking and alcohol abuse and also, recreational drug use and long-term medication use, these are some of the biggest issues that create what are called nephrotoxins, so toxins of the kidneys, and can be linked to the progression of chronic kidney disease. So you have to kind of do a self-analysis and find out, is that something that you're dealing with, right? Are you consuming too much alcohol? It's the holiday season. Like, is that something that you've been doing? Or is that something that you do where you need, kind of a nightcap in order to be able to go to bed, or to deal with stress, to adapt to stress? Is alcohol something that right now you're consuming too much of? Are you still smoking? And yes, I would consider vaping the same thing, except it could be even worse because of all the chemicals that you're bringing in. These things are really damaging to the kidneys themselves. They do things like, especially smoking and vaping, they end up damaging all these small vessels. They decrease the amount of oxygen that are getting to your tissues, and they end up creating, a lack of blood flow, which end up leading to tissue death. So we have to make sure that we're evaluating that. Now, when you're looking at blood work, there's some important markers to look at to understand whether or not you have proper kidney function. Now, remember, there's a difference between looking at medical norm on your blood work and looking at functional, so optimal ranges. And that's what we do in our office. And most of you guys aren't getting really good blood work anyway. And so if you're looking for wellness blood work, you're looking to dive deeper, that's something that we do in our office. And again, we don't do it based on diagnosis. We're not doing it based on treatment. We're only looking from a standpoint of finding out what's off from a functional standpoint so that we can right the ship well before it becomes an issue. So, if you're looking to get some wellness blood work done, you can find out more information about that on doctorswarren.com, DRSWARREN, doctorswarren.com. Now, when you look at things like the blood urea nitrogen, so BUN, when you see that on your, on your blood work, this is one that BUN, it's made by the liver, right? So blood urea nitrogen is made by the liver and cleared by the kidneys. So if BUN is elevated, you have to understand it indicates that there are renal issues. So the optimal range we're looking for is 13 to 18 milligrams per deciliter. That's kind of the optimal range that we should be looking at. And when we have this optimal range, or if we don't, now we can kind of start to dive in and find out, what's actually the issue there. So, having a functional high can be an indication of low stomach acid or dehydration, right? So it could be a very simple issue that we can solve pretty quickly. and kind of seeing that. And usually if I see bun and albumin, high, that's a good sign that there's some dehydration going on. And we can kind of do a quick fix. Sometimes it can be malnutrition, right? If you're not getting enough. Sometimes it could be, if you've got celiac disease and you didn't know it. Most people do, right? Because it's such a severe issue. Or you could even have gluten sensitivity that could be causing an issue. The GFR is checking like how well your kidneys are functioning. That's something that you can check with your doctor. Creatinine, this is important to look at because creatinine is a result of energy metabolism and is a byproduct of muscle creatinine phosphate. So basically it's removed by the kidneys at a constant rate, depending on the muscle mass of the person, and a renal problem will decrease the amount that's excreted. So you can see that on blood work. Also looking at things like albumin, the protein, that can show up, in the urine. Sodium, potassium, these are important ones to check. Sodium, especially because it's working on nerve transmission and impulses. So we really want to make sure that we're looking at that. For those of you that may have a potassium deficiency, this is some important signs to look for that may be an indicator that you have potassium deficiency. Are you having issues with your adrenals? Do you have hypertension, right? High blood pressure? Are you getting muscle cramping that's showing up at night? Weak bones, right? Do you have osteopenia or osteoporosis? And then also kidney stones. These could be signs of potassium deficiency, but there's one way to know. You can test and not guess. Also looking at things like chloride's important, phosphorus is important. I think looking at fasted insulin and A1C and C-peptide to find out, do you have insulin resistance? Is your pancreas working overtime to try to keep your blood sugar low? That constant secretion of insulin ends up damaging those receptors and leads to more and more insulin resistance and can be a contributing factor to chronic kidney disease. So before we go on break, guys, make sure you go over to doctorswarren.com. Find out more about us. Get registered for the blood sugar event coming up December 11th at Oaks Coffee Shop. Free event. It will fill up, so you want to grab your seats now. Or maybe you want to take advantage of the special we're doing this next month, and you want to come in and see us in our clinic. Guys, you can do that over there at doctorswarren.com. What you pay for the exam is a donation. So we're donating that money during the holiday season, so you can take advantage of that. So go to doctorswarren.com to find out more information about that. This is Wellness Radio. I'll see you right after the break. And so we have been talking all about kidneys and kidney health and kidney disease. And so now let's get into some strategies that really work well for working with the kidneys. And one of those early on, especially early on, it gets a little bit more complicated when we're talking about like kind of late, kidney disease, even renal failure. It gets much more complicated at this point. But when we're talking about early on, we talked about diabetes is one of the main contributors to chronic kidney disease. Therefore, what I find super helpful, especially at the beginning, is finding out, whether or not you're a good candidate to do something like a ketogenic diet. Because a ketogenic diet has been shown in clinical research to be anti-inflammatory, right? So we know that when we look at a ketogenic diet, we know that it lowers those advanced glycation end products that end up becoming like shrapnel and damaging your tissue and your vessels and that microcirculation and the way that you're able to get oxygen to your tissues. So, this may be something that's right for you. And doing it in an appropriate way, right? Like a ketogenic diet does not just look like butter and bacon. We know that it needs to be this concept that means we're still getting plenty of amino acids coming from healthy, clean sources, that we're looking at about 0.7 to 1, gram of protein per pound of body weight on a daily basis coming from clean areas of protein, things like grass-fed, grass-finished, beef, bison, lamb, chicken, turkey, wild-caught fish, wild-caught seafood, places like that. But that also it's full of, things like, a variation of organic, non-GMO vegetables and fruit, as well as nuts and seeds, and really kind of looking at it from that standpoint. can be super helpful for lowering inflammation, reversing, those blood sugar insulin issues that you're looking at. And again, the other big thing is that you're removing some of those toxins that are there, because we know that the kidneys filtrate, toxins. So some of the big ones are gluten and sugar and refined carbohydrates. Conventionally raised meat and dairy is dangerous, right? I do not like that stuff because it's loaded with antibiotics and hormones and things that we know can damage the kidneys. We also know that things like trans fat and hydrogenated oils, food additives and preservatives, things like highly processed vegetable oils and seed oils, artificial sweeteners, food dyes. These are all things that we want to cut out of the diet, and we want to consume more foods like, that are super healthy for the kidneys, that I think are overlooked quite a bit. And some of those that I really like quite a bit are things like cucumbers. They contain about 95% water. They prevent excess uric acid. They contain things like vitamin C and vitamin A and molybdenum and potassium, manganese and silica. These are important for helping to prevent uric acid buildup. Beets are excellent for the urinary system, high amounts of antioxidants and nutrients. They contain things like iron, and they contain things like betaine. And when you look at beets, they stimulate bile flow, which is important for removing toxic waste. So we need good bile flow. Lemons and limes contain a lot of vitamin C and citric acid and potassium. These can be super helpful. And then some of the herbs that I find are really overlooked that can be amazing for the kidneys, things like burdock root promote circulation, and nettles promote circulation. You can get that in tea form. Parsley, contains something called apigenin, which prevents oxidative damage to the cells and even shows like anti-cancer properties. So things like parsley and cilantro, we mentioned burdock and nettles. These are great herbs that can really help you quite a bit. Some of you dealing with like high oxalate levels, a very simple thing to remember: remove the high oxalate foods like Swiss chard, potatoes, chocolate, and nuts. Those can be high containing oxalate foods. And then you can supplement something like magnesium and potassium citrate, which actually help to bind to the oxalates when you consume those things. So you want to make sure that you're doing something very, very simple like that. And one of the things that we like to use in the office that helps a lot are things like glutathione, which is an important antioxidant. And then I also like to use things that really help with enhancing kidney function, and those are things that contain like marshmallow root and uva ursi, ginkgo and juniper berry. These are things that can support drainage and immune function of the kidneys and liver. So these are things that we can start doing today. Make sure you go over to doctorswarren.com to find out more information about us, and again, get signed up for the Blood Sugar Summit coming up on December 11th at Oaks Coffee Shop. And also, if you want to set up an appointment, take advantage of the donation that we're doing during the holiday season, guys, you can go over to doctorswarren.com to find out more information about that. This is Wellness Radio. We'll see you guys next time.